the LGBTQ plus community has higher rates of asthma. And one of the reasons they have higher rates of asthma is apparently they tend to smoke more than most individuals, right? They tend to
Higher substance use.
higher substance use overall.
And the fog machines. I'm done.
As a party, the fog machines. As a healthcare provider, that's important for me to understand.
Yes.
So that way, when somebody comes into my office and they identify with that community, whether it's lesbian community, what doesn't matter what it is, I need to be armed with that information. And so a lot of times we spend time trying to reduce our bias, but sometimes understanding that culture, you're going to have somewhat of a bias and you're going to ask questions like, what substances are you abusing?
Right.
Do you know what I'm saying? It's kind of weird to me.
Yeah, I mean, I'm sitting here and thinking it's just even with trying to reduce your own implicit bias, I think you step back into some kind of bias, right? Like the notion that you need to know about the alphabet mafia's likelihood of different health issues,
Right.
then now points you, the lens of how you're viewing their care from this is what I know about the alphabet mafia and their health,
Yeah.
disparities. Gosh, it's complicated.
It's so complicated because even when you're studying bias, it was just one of those things where it's like, wait a second, I actually use bias to help me with my clinical acumen at times.
That's right.
Understanding the genetics of certain races and cultures,
Yeah.
understanding, even my community and culture. There's a certain bias that I have and what I need to discuss and what I need to get to. And I think it's important for me to understand that to even try to narrow the gaps of inequitable care, which
Right.
we see.
Yeah.
Do you find yourself doing the same with the autistic community? Are there certain things that and you know that, yeah, this is biased, but I know that me being able to discuss this is going to help this person?
Oh, I'm sure there is. I mean, based on just 25 years of history and experience, right? I think it's natural that I'm going to carry with me my own lived experience and sort of do the shortcut math of, oh, this patient reminds me of a patient that I had before. These are the things that were effective in the past, or this sounds similar to the family story that I've heard this before. You can't help but do that. And again, I think that's sort of why I'm trying to bring actual data into decision making rather than us doing the shortcut math that we already do as human beings and sort of having that simple binary to bias highway, disrupted a little bit.
I think one of the problems with implicit bias, and implicit bias, all it is you're just unaware of the bias that you have.
Right.
I think one of the biggest issues with implicit bias that I can see is it almost allows you to answer the question of why without asking the question of why, which is really important. Because I think, for example, you've got a patient that comes in that has been diagnosed with congestive heart failure, all right? Congestive heart failure is a condition in which your heart either does not relax well enough or it does not contract as well as it should, which means that the blood that ejects from your heart does not get to your organs like it should, up to the brain, back to itself, to the kidneys. When that blood does not reach those organs, like the kidneys tell your body, hey, we need to hold on to more fluid. We don't have as much fluid. So then you become what we call volume overloaded. So people are swollen. And the way that we treat heart failure is we give patients diuretics to make them pee. Patient's been diagnosed with heart failure. They come into my office and they're still swollen. And they say, well, I'm not taking the medicine, right?
Yeah.
So I might label them as non-compliant.
Right.
Now when they go see another doctor and they have my note and they've got non-compliant patient, they're now biased because they don't think the patient's compliant. Right? Depending on where the patient comes from or what the patient's culture is, I may or may not ask the question of, well, why aren't you taking
that's
your
right.
medicine?
Why didn't you ask that question was the first thing I was asked.
Exactly, right. So again, you have to be, as a clinician, you got to be trained to ask why, because a lot of clinicians don't. They just use implicit bias all day long and they just assume things.